Welcome back. I'm News 10's Nicole Alley in for Christina this morning. Let's check in with News 10 Chief Meteorologist Steve Caparizzo for this week's Pet Connection Extra. Steve?
Thank you, Nicole. Kidney disease is an illness that many of us cat owners will likely have to go through at some point. It can be from a long illness and not drinking, or just age and the kidneys not functioning the way they should. I went through this with one of my older cats not too long ago. You need to learn to get fluids into their bodies, or you will have big problems.
Basically, these cats that have kidney disease, they can't concentrate their urine very well. So when they're urinating out a lot of fluid, they essentially are always in a state of dehydration. And many people will say that their cats are drinking a lot of water, which is true to compensate for that, but they can never compensate quite enough to really replace the fluids. So when you're giving the fluids under the skin of the animal, it hydrates them and takes a lot of stress off the kidneys.
The procedure can be a bit intimidating, but with help from your veterinarian, you can give fluids to your cat.
So it's important to have your cat in a comfortable position. It can be on another person's lap, or sometimes putting them in a box or a carrier can be a good thing so that they feel a little bit more contained. You would get the fluid set up from your veterinarian after they prescribed it, and you basically want to hang it higher than the level of the cat, and basically the fluids come down, they go through the line, and then they're going to go underneath the skin of the cat, right where they have all the skin on the back of their neck, this extra skin. You're making a tent with your fingers. So you're going to uncap the needle, pick up the skin, and stick it directly in. Usually after that first pinch, you just let go of the needle, and you're going to open up the fluid line, and the fluids start flowing down through the line, and they're going into the back of the animal. So here's the bubble forming right under the skin of Cirrus here. When you're finished, shut off the fluids and pull the needle right out of there. It will get absorbed over the next couple of hours through the skin of the cat, and that basically goes into their body and helps to rehydrate them that way.
Thanks, Dr. Jackie. Consult with your veterinarian for the dosage and the number of times per day. This is an option for those of you that have cats that are more docile and laid back. While this will never cure kidney disease, the treatment will allow your pet to have a longer and better quality of life. Back to you, Nicole.